Some of COVID's worst impacts came at nursing homes. Months after an outbreak at Kingsport's Wexford House, the medical director says the trauma still weighs heavily.
That was absolutely the most frustrating and challenging emotional event in my medical career.
Dr. Marta Waite hopes nothing approaches the strain on staff and residents when Wexford House in Kingsport endured a devastating COVID-19 outbreak between Thanksgiving and Christmas.
To be able to look down the hall and see PPE everywhere, residents crying out, not being able to get the help that they needed, and the nurses doing everything they could.
That was life inside at multiple area nursing homes over a period of outbreaks that lasted months.
Up until the advent of the vaccine, we were losing 2 to 3 people a day.
The most challenging part was how many staff members were we going to lose to COVID, because we did. How many residents were we going to lose to COVID? How are those families going to respond?
Waite said families were gracious even as nearly 24 residents died in a wave that infected more than 105 and nearly 80 staff.
The only negativity we felt was, again, the families not being able to come in and visit.
The grace extended was a godsend for a staff stretched thin as one after another endured COVID quarantine.
The remaining staff had to work sometimes 18, 20 hours in a row, then come back a day and a half later and work again that long. It was a war zone, I can tell you that.
The virus was nothing if not opportunistic. Despite strict protocols, it snuck into the facilities easily, Sullivan County Regional Health Department Medical Director Dr. Stephen May said.
A lot of the disease we recognized came in with the staff and employees where they had community exposure.
Waite said everyone jumped in, just trying to keep the chaos somewhat at bay.
There were physical therapists who were changing briefs. There were administrative personnel that were handing out water.
But COVID was relentless. And despite all efforts, staff watched beloved residents, including previously healthy ones, fail to survive.
We're like family here, and most facilities will tell you the same thing. You don't expect anything to happen to them because they're doing okay, and then all of a sudden they're gone. I think that's been harder.
You wished you could have done more or picked it up earlier or done anything else with it, but we pick up the pieces and go on.
The worst outcomes weren't limited to residents.
We had one of our nurse leaders pass away. His wife worked here as well. She has had a hard time coming back into the building because of it, and we don't know that she's going to return to work here with us.
Waite is concerned about a much larger exodus from a sector that was hard-pressed to fill positions even pre-pandemic.
If there were folks on the maybe considering retirement, they retired early. Some took jobs completely out of healthcare just to get away from this. And the staff that's here, they're all working overtime. We don't know how to fix it.
Ballad Health Chief Nurse Executive Lisa Smithgall said the system has increased pay for CNAs and other bedside staff at Wexford House and its other long-term care facilities.
We've had multiple adjustments recently trying to say this is important to compete with the market and to meet the needs of the organization.
But COVID's impacts blunted the success of that effort. Many typical recruits had been laid off from service jobs, and pandemic unemployment paid more than a high-stress nursing home job.
So it became very, very difficult for us to recruit during the last year for those unlicensed roles.
Waite says she doesn't blame people for shying away as the COVID crisis ground on.
Medical school and residency, it prepares you for a lot of tragedy, and you learn how to compartmentalize. But even then, those were very challenging days. It made it hard to want to come back the next day and the next day.
She says American society doesn't provide the financial or emotional support that close to 1.5 million residents and 1 million plus healthcare support staff deserve.
We're beholden a lot to insurance reimbursement.
Taxpayer-funded Medicaid pays almost 60% of revenue nationally. Medicare, another 14%.
That can cover, of course, room and board and minimum staffing. So if you really want great care, you have to charge more to get more staff in the building. And that's a challenge. I don't know that we'll fix it anytime soon.
The needing fixing hit such a low point last year, Waite said without her faith, she could have been more of a hindrance than a help to those around her.
At the end of the day, it was still absolutely a feeling of helplessness. I would have been extremely negative. I really wouldn't have been a help to anybody emotionally. So my faith has gotten me through all of this tragedy. And I hope it's been an example to those around me.
But faith doesn't get vaccine into arms. By mid-March, only 32% of Tennessee long-term care staff were fully vaccinated, according to a Center for Public Integrity report. Statistics like that concern Stephen May.
The bulk of the disease was brought in primarily by the staff, and that's why now it's so important we get healthcare facility workers, staffs vaccinated.
Waite admits she's no Susie Sunshine about the situation, but says society can't wash its hands of a troubled reality.
Long-term care facilities, they serve a purpose. Not everyone can be home. So we want to try to make it a good environment for them. But again, it's going to be a big challenge to try to overcome all of the staffing shortages that we faced during this pandemic.
Many weeks have passed since Wexford House last saw a COVID case. The facility is still looking for good staff. In Kingsport, Jeff Keeling, News Channel 11.